Hello, my name is Bas Weusten. I'm a gastroenterologist at the St. Antonius Hospital Nieuwegein and professor of GI endoscopy at the University Medical Center Utrecht. I'm very happy to discuss with you in this YouTube video our study comparing two different dosings in focal cryoballoon ablation. But before I discuss with you the results, I would like to show you the system for those of you who are not familiar with this system. Here you can see the system. The system comprises of a handheld controller, which is connected to a foot switch and to a balloon catheter. And it's a 3D endoscope balloon. You can look through the balloon, and this is how it looks like if you ablate a short segment circumferential Barrett's. So you can aim the diffuser at a particular spot you wish to ablate, and then you can rotate the dispenser, and that can result in side-by-side ablations covering the entire circumferential Barrett's. And of course, you can extend that to baritons or islands more proximally if those are present. And it's important to realize that the depth of ablation is related to the duration of the ablation. So the dosing is expressed in seconds of ablation. So why did we perform this study? Well, this study is a result of a larger study, the so-called Euro-Coldplay study. And in the Euro-Coldplay study, we investigate the efficacy and the safety of focal cryoballoon ablation for limited Barrett's esophagus. And this is a European multicenter study aiming for 107 patients to be included. We started with a dose of 10 seconds in that Euro-Coldplay study, and that dosing was based on previous work from our group, but also from a multicenter US study published by Professor Kanto in GI endoscopy of 2018. When we executed this study, we discovered that there was more scarring in the esophagus as a result of cryoballoon ablation than we expected. And then we realized that there had been some changes in between the earlier dose finding studies and our current study. That is that the cryoballoon ablation system has had an upgrade from the first generation to the next generation equipment. And this has led to a really profound investigation of the manufacturer of this device. And that showed that by changing the system, by updating the system, the intensity of the energy delivered by the system was increased. It was increased in approximately 20%. So therefore, we started the Euro-Coldplay study all over again with a lower dose of 8 seconds. And in the present study, we compared the first 28 patients treated with the 10-second dosing with the second consecutive 28 patients treated with 8-second dosing. And we compared the efficacy of one single treatment session with those two dosings, as well as the safety. And what we found was that in terms of baseline characteristics, both two cohorts were similar in terms of age, gender, but also on the median Barrett's esophagus length, being a median of C0 and 2. So we assessed the efficacy, and efficacy was defined as the percentage of Barrett's surface regression after one single treatment session of cryoballoon ablation. And we also assessed safety as measured by the stricture rate. And the results were that the efficacy between those two dosings was similar. In both groups, after one single treatment session with cryoballoon ablation, the Barrett's surface regressed with 80%. However, the differences in strictures were not statistically different, but of course the numbers are very limited to show any difference. What we did find is that in the 10-second cohort, there were 3 strictures necessitating more than 3 dilations, whereas in the 8-second cohort, there were no strictures necessitating 3 dilations or more. We therefore concluded that in patients with limited Barrett's esophagus, single session cryoballoon ablation with 8 seconds showed a similar Barrett esophagus surface regression as compared to the 10 seconds. And a lower dose of 8 seconds may theoretically result in fewer and less severe strictures. Therefore, we recommend the use of 8 seconds as the standard dose for the current device of cryoballoon ablation.